Ya Allah.
Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself to you all. My name is Dipta Septiya Rena Ningtyas. You can call me Dipta. I am from Ofringi. In here, I want to tell about obesity. Do you know about obesity? Obesity is a chronic condition caused by a very high buildup of fat in the body. Obesity in children occurs when their weight exceeds the normal weight based on height. This condition is dangerous because it makes them at high risk of suffering from chronic disease and experiencing stress. This condition not only affects the physical appearance of the sufferer, but also increase risks in health such as heart disease, diabetes, and high blood pressure. About 4.5 million American children are severely obese, and pediatricians say more of them should be recommended to get weight loss surgery. New policy statement from the American Academy of Pediatrics or AAP asserts that the obesity epidemic now places many children and adults at risk of living significantly shorter life than their parents. While pediatricians can help patients lose weight through lifestyle change, these adjustments often don't result in significant or lasting improvement in children with severe obesity, who might be more than 100 pounds overweight, according to the paper published October 27 in the journal Pediatrics. In children, severe obesity is defined as having a body mass index or BMI of at least 1020% of the 95 percentile for one's age and sex, according to the statement. At this weight, children and teens face greater risks of developing chronic disease than their peers. Health conditions such as high blood pressure, sleep apnea, and type 2 diabetes occur more often in severely obese children, along with mental health conditions such as depression. Uh, hmm, weight, weight loss surgery may offer a better solution than standard treatment for severe childhood obesity and its accompanying health problems, wrote Armstrong and her co-authors. The group compiled studies of people 18 years old and younger who had undergone the procedure and found that many enjoyed lasting weight loss and a reduction in related health conditions. For example, one study followed adolescents up to 12 years post-surgery and found that patient BMI dropped 29% on average, and the incidence of diabetes and high blood pressure dropped significantly. In contrast, severely obese children who made only lifestyle change gains weight in the long term. In addition, few patients who had the surgery experienced complications, and when they did, the problems were usually minor, the report said. But despite its safety and effectiveness, weight loss surgery isn't a quick fix. Armstrong told the Associated Press, "It's a lifelong decision what with implication every single day for the rest of your life," she said. After surgery, patients must stick to specific nutrition and activity recommendations according to Healthy Children or the AAP informational website for parents. Unfortunately, as of now, most kids with severe obesity don't get weight loss surgery because it usually not covered by public or private health insurance, and it can cost up to 200,000. Armstrong told the AP. Some children may live far from surgery centers, which also reduces access to the surgery, she said. In its policy statement, the EEP said that insurance should cover both the surgery and follow-up care in order to enable more children with severe obesity to undergo the procedure. Although pediatric obesity surgery rates have tripled in recent decades, American doctors still perform fewer than 2,000 operations each year. The EP report, although pediatric obesity surgery rates have tripled in recent decades, American doctors still perform fewer than 200 operations each year, the EP report. Five Newsom, now a senior at the University of North Carolina in Chapel Hill, underwent the procedure at age 60. At the time, she was 5 feet, 8 inches tall and weighed 2,073 pounds, meaning her BMI was almost 42. The following year, she dropped about 100 pounds. Today, her weight is within a normal range. The AP asked if she ever regrets the surgery. Uh, Never, Newsom said. Teens should be able to discuss every option with their doctor, and surgery should be one of those options. Okay. Assalamualaikum warahmatullahi wabarakatuh. Stop.